Do we administer oxygen to a patient who is having a confirmed STEMI or a patient that's complaining of chest pain? Let's talk about it. And the answer is it just depends. It depends on the patient's presentation, the overall situation, vital signs, etc. In EMS, when we are considering which medications we're going to administer to a chest pain patient or a patient that we know is having a STEMI, oftentimes we use the mnemonic MONA or FONA, which stands for morphine oxygen nitroaspirin or fentanyl oxygen nitroaspirin. Now, this certainly doesn't mean that we can't administer a medication outside of those four if our patient is in need of it. Let's say they're nauseous, administering an antiemetic would obviously be needed. But we need to talk about the elephant in the room, and that is the EMS educators that are teaching or the EMT students that are learning that oxygen is a harmless drug and every patient should be put on oxygen, high flow oxygen at that. This is simply not true. It's encouraging our students to not critically think, to just be robots and throw every patient on oxygen. So let me roll back some footage of me back in 2020 explaining why we should not hyperoxygenate a patient complaining of chest pain or a patient that is having what we interpret as a STEMI.
Many protocols are shifting away from this, mainly because of the AHA science that's coming out, that hyperoxemia can increase coronary artery resistance. It can also slow the perfusion of the heart. So if the patient doesn't end up passing from the heart attack, they could end up with a larger injury to their actual heart. So AHA is suggesting if they're at 94% or above, not to add supplemental oxygen. If they're not there, then add supplemental oxygen to get them to that area.
So am I saying to withhold oxygen on a patient who is having a STEMI or is having chest pain? Absolutely not. I am not saying that if they are hypoxic, give them oxygen. But if they are sitting at 94% and above on room air, there is no need to run the risk of hyperoxygenating these patients. And at the same time, let's quit perpetuating this narrative that we were taught that oxygen is harmless and that every patient should get it, because it's simply untrue.